I've gathered all my necessary equipment and supplies, and I'm ready to head into my room.
Hello.
Hi, I'm Ingrid. I'm gonna be your student nurse for today. How are you doing?
I'm doing good.
Good. I'm gonna go ahead and wash my hands, provide you with some privacy. Could I see your armband?
Yes.
Perfect. Can you tell me your name and date of birth?
It's DW11/28/2024.
Sounds great. So today I'm just gonna be doing your head to toe assessment, and that's gonna include just looking at your respiratory system, your cardiac or cardiovascular system, your skin, your abdominal, and your muscular system, okay?
Okay.
So I'm gonna ask you a few questions, and then we'll do a few other assessments, okay? So could you tell me where we are right now?
We're in the library.
Okay. Could you tell me what we're doing?
We're doing an assessment.
Perfect. And then could you tell me what year it is?
2025.
Perfect. So my client is oriented ×4 to person, place, time, and situation. While she was answering those questions, I also assessed her her face, and I see that she has no obvious physical deformities. She is groomed and appropriately dressed for the occasion. She was maintaining well eye contact. She has clear speech. She's very oriented, like I said, and she is showing appropriate facial expressions for this conversation. I also assessed her skin, and it looks appropriate for her ethnicity. And do you have any problems with your eyes?
No.
Okay, so she has no visual concerns for right now, as well as hearing. Have you had any hearing concerns? Okay, we'll get a little bit more into depth in a little bit, okay? So now I'm gonna go ahead and start with your neurological system. So we've already assessed your orientation, but if you were to have been a little bit more confused, we'd use the scale. It's called the Glasgow Coma Scale, and it just it's a scale that goes from 1 to 15, 1 being the lowest of oriented and 15 being the highest of oriented. So you were a 15 right now, and it includes your eye-opening, verbal, and motor. Yes. Okay. So I'm going to go ahead and inspect your head, all right?
Okay.
So I see that your head is normal cephalic with symmetrical facial features. Have you had any headaches recently?
I have not.
No? Okay, good. So now I'm going to go ahead and take a look at your eyes, okay? So do you wear any contacts, your eyeglasses?
Nope.
Nope. Okay, so first I'm going to look at your pupil size, so just look straight for me. Perfect, they are about a 4. And now I'm going to test for reaction to light. So you're just going to look straight, and I'm going to shine this light into your eyes, okay?
Okay.
All right. Perfect. Now I'm going to have you look at this object and just follow it, okay?
Okay.
All right. So your pupils are equal, round, and reactive to light and accommodation, okay? So now I'm going to look at your ears. Is that okay? I'm going to take a quick look. All right, and take a look at the other ones. All right. Have you had any experience with ringing in your ears? No? Okay. So the ears are symmetrical. I don't see any drainage or any blood coming out, okay? So that's good. And now we're going to look at your nose. So I'm going to just shine the light real quick. Okay, and then your nose seems to be symmetrical. If you could just cover one nostril and breathe in. All right, do the other one. Perfect. Have you had any congestion lately? No. Okay, good. Now with your mouth, have you had any trouble when you're chewing or anything? No. Okay, I'm gonna have you open your mouth for me. Perfect. Okay, so your oral mucosa is pink and moist. There's no lesions. Your teeth don't seem to have any decaying, so that's good. Have you had any trouble swallowing?
No.
All right, so I'm gonna have you lean back and I'm gonna place my hand right here. If you could just swallow. Perfect. All right, that was good. Now we're going to take a look at your respiratory system, okay?
Okay.
All right, have you had any trouble breathing lately?
No.
No? Okay, let me get your respiratory rate real quick.
Okay.
So if you could just relax and I'll count down. All right, so I got 7, which would be 14 in 1 minute.
Okay.
Have you had a cough lately?
I have not.
No. So no sputum to
No.
report. Okay. So I'm gonna go ahead and listen to your breath sounds. Is that all right?
Mm-hmm.
Okay. So I'm gonna start on your upper lobe. Yes, and every time you feel my stethoscope diaphragm move, just breathe in, okay? All right, you could lift your breast. All right, if you could put your arm across. Okay, perfect. All right, now I'm gonna do the same on the other side. Perfect. I'm gonna have you turn. Thank you. And I'll do your upper, left lobe, right upper lobe, right lower lobe, and your left lower. Perfect. Now I'm going to teach you about some techniques that you could use in case you do get a cough.
Did you hear any suspicious sounds?
No adventitious sounds. Everything was good.
Okay.
So, also with your respirations, I noticed that they were even and unlabored with no retraction. So that was very good as well. With the techniques that I'm going to teach you, if you do end up having a cough and you happen to be bed bound, you want to try to flip over to your side every maybe hour or so. Take a deep breath in and cough it out, and that's gonna get any sputum that's stuck in there out.
Okay.
And then I'm gonna show you this little tool we have. It's an incentive spirometer.
Mm-hmm.
So maybe every 2 hours or every hour, about 10 times in the hour, you're gonna take a deep breath in, hold it for 3 to 5 seconds, release, and then just repeat it.
Okay.
All right. Okay, so now I'm gonna go ahead and move on to your cardiovascular system. So have you had any chest pain recently?
No.
No? Okay, so I'm gonna go ahead and look at your neck
Mm-hmm.
just to see that jugular vein, okay?
Okay.
So if you could lift your head back and turn, perfect. All right, and then turn the opposite way. Perfect, so I see no jugular vein distension.
Mm-hmm.
Now I'm going to go ahead and assess your radial pulse, okay?
Okay.
So I'm going to assess right here. All right, it is a +2 bilaterally. Now that I'm here, I'm gonna go ahead and check your capillary refill. Okay, and it refills in less than 3 seconds. I'm gonna check for edema. No edema bilaterally. Now I'm gonna do your toes, okay? So, okay. The capillary refill is also in less than 3 seconds. I feel no edema. And now I'm going to check your dorsalis pedis pulse. Perfect. And then your posterior tibia. Good. So all of those were both +2 bilaterally.
Okay.
I could also assess your popliteal pulse, your femoral pulse, your brachial, your axillary, and then your carotid, but I wouldn't do those at the same time.
Okay.
All right, so now I'm going to listen to your heart sounds, okay?
Okay.
So just relax for me, okay? So I'm going to start at the aortic, pulmonic, herbs, tricuspid, and then mitral. Thank you. All right. So S1 and S2 were present, which is good. I heard no adventitious sounds. If I were to hear any S3 or S4, I'd flip and use my bell.
Okay.
And I'd go back in that same pattern just to make sure that nothing is wrong. Okay?
Okay.
All right. So now let's go ahead and move to your abdominal system.
Okay.
So I'm going to have you lay down if that's okay with you.
Okay.
All right. So first I'm going to expose my patient, just her abdomen. And could you tell me if you've had any tenderness or pain in your abdomen lately? Okay. How about your last bowel movement?
Was this morning?
It was this morning. What was it like?
It was brown and snake-like.
Okay, perfect. And then have you been passing flatus?
I have. Yes.
Okay, good. So I'm also taking a look at her abdomen. The skin color is appropriate for ethnicity. I see no signs of distension of the abdomen, no lumps, bumps, or bruises. So I'm going to go ahead and listen to your bowel sounds, okay? So I'm going to start in the right upper quadrant.
So low. I'm feeling so low right now. Thank you.
Right upper quadrant. It starts at
I
right.
thought it was right lower.
Mm,
I apologize. I'm confusing my doctor.
it's okay. Right upper
It's been a
quadrant.
long day, doctor.
Left upper
I'm
quadrant.
sorry, my nurse.
Left lower quadrant. And right lower quadrant. Perfect. So your bowel sounds are normal active. They're present in all 4 quadrants. So now I'm going to go ahead and listen to your vascular sounds. So that's going to be in your arteries, okay?
Okay.
Okay. So I'm going to start with your, and this will be with my bell.
Okay.
With your aortic artery, the renal arteries, and the iliac arteries. Perfect. So now I'm going to go ahead and lightly press on your abdomen.
Okay.
And you just let me know if you feel any tenderness, okay? So we'll do that in a circular motion. Did you feel any tenderness? No. Perfect. All right, so now we are going to assess your urinary system. So have you had any pain with urinating recently? No? Okay, perfect. All right, well now we can move on to our musculoskeletal system.
Okay.
Before we get started, have you had any broken bones that you're aware of?
No.
Nope, okay, good. So we're just gonna be testing your range of motion, okay? So I'm gonna have you stand back up, and if you could stand over there, and you're gonna walk towards me and then walk back. Perfect. So her gait is normal. She has good balance. I'm gonna have you stay standing, all right? So first I'm gonna have you extend your arm out. Perfect. So this is what we call pronation, and then if you flip it, it's going to be supination. Okay? All right. So I'm gonna have you push down. All right, good. And now push up. Perfect. Her strength is a +2. So now I'm gonna have you do your fingers. So again, we're gonna keep them right here. If you put them together, it is abduction, and if you spread them apart, it is adduction. I'm sorry, I said that backwards. That's abduction, and this is adduction. Okay. All right, so now if you could just push down on my hand. Perfect, and now go up. Good. All right, so now I'm gonna have you push your knee back,
Where?
kind of hitting your booty. with your leg. Okay, so I'm gonna put my hand on your knee. All right, now if you could extend it, put it back down. Perfect. All right, so I'm gonna have you push back. Okay, and now forward. Good. So the strength is also a +2. And now you could go ahead and take a seat. Okay. And I'm going to assess your ankle. So you're going to turn your foot towards the inside. All right, that's called inversion. And then if you point it outwards, that's eversion. Perfect. So now if you could just try to push my hand up. All right, and now try to push it down. Perfect. All right, so your strength was also a +2 in all your extremities. So I'm going to go ahead and document all that and then get it to the provider and he'll come and check on you, okay?
Okay, thank you so much.